everyone, welcome to another edition of Keeping It Local, where I interview businesses in the Oaksmar and Palm Harbor area. My name is Kim Clark and I'm a realtor with Caldwell Banker. And today I'm interviewing Dr. Bradford Myers of Woodlands Chiropractic and Massage, which I'm really excited about interviewing Dr. Myers because he has a plethora of interesting and relevant information which he's going to share with you all today. So, without any further ado, let's get started. So, thank you for joining us, Dr. Myers.
Thanks for having me.
So, as we begin, just kind of let us know, tell us about your business. What do you do, how you got started, and your life history, whatever. Just feel free to share.
No problem. I've been a resident in Palm Harbor for almost 20 years now. Just recently took over the practice from a doctor who retired. Been in March of 2020, so right before the COVID shutdown, I took over. But we have a full service, family-run chiropractic office with massage. We have 3 different massage therapists that work for us. We have therapeutic massages, multiple different techniques in therapeutic massage. We have relaxation massages. So from the chiropractic side, it's a little bit different. We have the full service where you get more than just an adjustment. So we have modalities as well. So things like mechanical traction, e-stim, ultrasound, infrared treatment. We do ionic foot bath detoxing. We've got some rehab equipment as well, so we do some light rehab as well. There's a little bit of everything, but we are, I said, a small practice. We've got 3 massage therapists and 2 receptionists and me, so it's a small office.
You know, I've always been a coward when I think about getting my neck cracked. It's like, oh, so tell me, are the techniques that you provide just as effective as that?
Yeah, we offer multiple different techniques. I'm trained in lots of different techniques. Techniques are specific to the individual patients. I use a lot of what's called Activator Technique, which is the little click tool that a lot of people are familiar with. I especially like that in the cervical region and the neck region because it's very, very gentle. There's no twist with that. The advantage to it is that it's very low impact and you're not twisting on the neck. Neck adjustments are fine for most people, but if you have really tight neck muscles, then if you're pulling on a tight muscle, then sometimes that can aggravate it. So a lot of times people with really, really tight neck muscles especially will respond much better to the little click tool instead of an actual twist adjustment. So I have some patients who prefer twist adjustments, and that's not a problem. We can accommodate that, but I do utilize a lot of Activator just because it's a very effective technique and it's much more gentle.
Well, that twist adjustments, good accurate description of that. So, Dr. Myers, what made you become a chiropractor in the first place?
I've been going to a chiropractor since I was 8 years old. My first experience with a chiropractor was when my mom was going to one in Seminole. I had really bad food allergies as a child growing up and was very, very sick, and medical doctors, nobody could figure it out. And just happened to be she was in getting a chiropractic treatment and was talking to him when I was 8 years old, and he said, made a suggestion, run some blood work, and come to find out that I had really bad food allergies. So I had been really sick for the first 8 years of my life, and it was a chiropractor who figured it out. So that was my first experience with chiropractic, and that's more on the nutrition side of chiropractic. But on the physical side of it, I'd seen a chiropractor through my youth, played a lot of sports, neck issues. One day I woke up and I couldn't turn my neck, and I had to spend the whole day in school with my neck locked up, so I went to the chiropractor afterwards and fixed it, and I could move my neck around, and especially sports, a lot of sports. Then car accidents. I was in a car accident as a teenager and a car accident in my 20s, and so I got a lot of experience with chiropractors then, and that's where a lot of people get their experience with chiropractors, is car accidents. But we do a lot more than that, and so I just have always been a fan of it. It always worked for me, and I got the opportunity to go to chiropractic school. I had the choice. I could go to medical school or I could go to chiropractic school, and chiropractic I always had a passion for it. I always embraced it because of its success with me. So it was something that I was always passionate about, and was blessed with the opportunity to go to school for that, and became a chiropractor.
So, first-time patient, what can they expect as they come to your office for the very first time?
A lot of education. One of my big things is I highly believe in educating patients. I like education because I want patients to understand exactly what their situation is, what the treatments are going to be to help them, how it's going to help them, and how they can help themselves. I'm very compassionate and empathetic because I've been a chiropractic patient. I have back issues, I have neck issues myself, so I have been a patient as well as the doctor. So I've been on the other side of the table, so I understand how it feels. Again, one of the big things is I want people to understand what's going on with them. So an educated, informed patient, helps me be more effective, and it also helps with their treatment as well. So I spend a lot of time with my patients, educating them, going over things, answering questions, talking about what we're doing, and just that's a big thing with me.
That is so. What is something that most people don't know about a chiropractor? There's got to be something that we just don't know. I like these little secrets.
I mean, we're a lot of people think of us for things like car accidents, and that's what we're probably most famous for, is for car accidents, because we do help with musculoskeletal concerns, so muscles, bones, ligaments, tendons. That's our area of expertise. That's what we work with mostly. But we do nutrition as well. We talk to patients and discuss nutrition and different vitamins, supplements. We discuss rehab protocols, so if you've got an injury, give you some exercises, some stretches. So there's a lot more that goes on to it beyond just a twist adjustment. There are some chiropractors in the area that do nothing but adjustments, that don't do any of that additional stuff. But most chiropractors, and most real chiropractors, we utilize a lot of the other aspects of it. From the rehab to nutrition, it's all part of it. It's all part of the holistic part of it. It's the whole body, treating the whole body, and not just an adjustment and off you go.
So what would you say most of your patients appreciate what you do?
Most of my patients absolutely love coming in. They become part of our family. We have, again, it's a small practice. We're not the 40, 50 patient a day practice. You're not going to sit in the lobby for 30 minutes. When you come in, you go back right away. They love the convenience of it. They love the relationship that we build with them. They really become our extended family. We know how, while you're here, we talk about how the kids are doing, how the dog's doing. We love our patients, and our patients love us.
So as we wrap things up, is there anything you'd like to tell the community? Any final words?
Regular maintenance. Your vehicle needs it, you need it. Take care of yourself, and your body will take care of you. Don't neglect yourself. Your body is, our health is the most important thing that we have, and you have to take care of it. So take care of yourselves. Listen to your body. If your body tells you something's not right, something's not right. So listen to it. Don't be afraid to ask questions. Whether it's with me or with another doctor, definitely do not be afraid to ask questions. You want to be educated, you want to be informed. You have a right to know what's going on with you. And if there's anything that we can do to help you here, you can always give us a call. We're happy to help. We're happy to answer any questions you can ask for me. We're here Monday through Friday, pretty much 9 to 5. Run a couple later hours on a couple days, depending on if I got my kids or not. But we're here to help in any way we can. So we got chiropractic and massage therapy here. Whatever you need, we can take care of it.
And why don't you just let us know your phone number while we have you?
Sure. It's 785-2771. 727-785-2771.
Okay, that's simple enough. So thank you, Dr. Myers, for taking the time to spend a few minutes with us to let us get to know you and your practice just a little bit better. So, and I highly recommend Dr. Myers. This is just not an interview. It's a personal recommendation for you to be sure to call him if you have any questions or concerns about your health. So that's all we have for now, and goodbye.